You can't imagine how how much we've had to fight for something this basic this past year. I can only deduce that they don't want to spend the money. Our hospital systems are profit over patients, profit over the safety of their staff. It's not like the nurses and the frontline healthcare workers are in it for their own gain. We're in it to save lives. We're in it to save lives. And we shouldn't be penalized because of that.
That was the head of the Minnesota Nurses Association talking to the Associated Press about being forced to reuse medical-grade face masks even as U.S. stockpiles fill up with millions of N95 respirators. In its new report, the AP spoke with manufacturers, hospital officials, and frontline workers, including the head of a company with its own stockpile. He recently received government approval to export N95 masks because there aren't enough domestic orders.
Everyone's saying there's a shortage, yet I am drowning in respirators. They should only reuse them if there's nothing else, if there's no other choice. But there is a choice. I have millions of respirators. If we had our druthers, it would be to sell here and help America. But when we're in a situation where our warehouse won't hold any more respirators, we're going to have to send them wherever we can.
Jason Deeren is one of the reporters behind that story. He is an investigative reporter for the Associated Press and author of the new book, Kill Shot, A Shadow Industry, a Deadly Disease, which tells the story of the worst drug contamination outbreak in U.S. history. Jason, welcome. Thanks very much for being with us. So you report how before the pandemic, nurses would throw out a mask and grab a new one after each patient to prevent the spread of disease. How and when did that change, and did masks ever go back to being used only once?
Well, thank you for having me. The answer is right after the pandemic started, there was a run on N95 masks, and supplies dwindled, disappeared from stockpiles and distributor shelves. And so hospitals started looking overseas and to other sources to get these N95s. The United States responded by approving some 19 domestic makers of N95 to try to bridge that gap in supply. And that happened over the fall. But those masks, while being made, have not found their ways to hospitals. So there still is this, there are masks being made, but there's a disconnect in the supply chain, getting them to hospitals still. So hospitals are holding on to the ones they have in case there's a future surge or run on masks, and they want to make sure that they have enough going forward. And so they're limiting their staff in the numbers that they can use per day.
So where does that leave healthcare workers? How are they improvising to reuse these masks that were designed to be worn one time?
Well, you can imagine working in an ICU, COVID, ward at a hospital, how stressful and careful you have to be. Now imagine doing that with, a lack of protection that you think is what you need to keep yourself safe. That, for most nurses and doctors and folks that we talk to, is one mask per patient. You treat a patient, you discard that mask, and you get a new one for a new patient. So you have the stress of operating in a once in a century type pandemic already, and then you add to that the lack of PPE or a shortage of PPE, and it's put a lot of people, like the nurse you saw in the lead up to my interview here, under a lot of stress, and it's very emotional for many of them.
Well, help us understand this. I mean, new COVID cases, deaths, and hospitalizations have all been dropping in the past month. Vaccinations are rolling out. So why are hospitals continuing to limit N95 masks if there's no longer such a lack of supply?
Right. We asked a number of hospital procurement officials that exact question, and we heard a range of answers, but it all boils down to, in their words, a fear of a future surge. Given the uncertainty we've seen in many realms in our lives over the last year, but especially when it comes to the pandemic, the twists and turns and surges, these officials say they just want to make sure that their shelves are full. If another surge comes, we're talking about new virus strains, things like that, unforeseen needs for masks. They want to make sure they have them in stock. But nurses and doctors and those working on the front line say you shouldn't be stockpiling masks when you have a surge right now. There seem to be enough masks in the supply chain system for everyone to have what the masks they need and to return to these pre-pandemic guidelines of 1 mask per patient. Hospitals on one hand are saying they want to make sure they're ready for the future and have the stockpiles that they need, and the workers saying, well, we have what we need. And that's where, this kind of disconnect with the government comes in, because there are enough masks being made. They're just not being, the makers of those masks are not being properly connected to those who want to buy them. And so that's where this disconnect that we're writing about in our story comes from. There's a lack of communication from the federal government right now in organizing these 19, 20 new domestic mask manufacturers with the customers that need their masks.
So, right on that point then, Jason, the AP obtained internal government emails detailing a logistical and information breakdown. Is that essentially what those emails said, is that there was just the disconnect, as you say, between those folks who were ready, willing, and able to provide those N95 masks, and then the healthcare workers and the hospitals, I suppose, especially, who are going to be buying them in bulk?
Right. Well, the emails that we obtained show that as in December and in November, there was a frustration inside CDC, which oversees the agency NIOSH that approves these new mask manufacturers. There was a frustration in this apparent disconnect that we're reporting on here now in February. That it was the head of NIOSH, Dr. John Howard, was alerted to this by someone in the director's office at CDC, and was told that they needed to do a better job through their website or other means in communicating with hospitals that there are millions of new masks on the market that can be sold. The emails show that level of disclosure by NIOSH didn't occur. In part because the agency was concerned with looking like it was giving preference to one manufacturer or another, wanted to be fair. I think they're required, to not choose one company over another and seem like they're trying to pick sides. And so there was a worry about that. And so that's what the emails lay out for us, is that, months ago, this concern was being debated. And it still, as of now, doesn't appear to have been fixed, because the hospitals are still struggling with these shortages.
It's just really eye-opening, Jason, to think about domestic manufacturers with supply on their hands exporting some much-needed PPE overseas in the middle of this pandemic. Really sobering report. AP investigative reporter Jason Deeren. Jason, thank you very much.
Thank you very much.